everyone. My name is Dr. Uche Blackstock. I am an emergency medicine physician based in New York City. I'm also the founder and CEO of Advancing Health Equity, an organization committed to addressing racialized health disparities. The last few weeks have been unprecedented for many of us. I've been working and seeing patients on the front lines, and it's been very scary, to be honest with you. I've been practicing for 15 years, and I've never seen anything like we've been seeing recently. Something else that we've noticed in New York City is that particular communities, our Black and Brown communities, have been most heavily impacted by COVID-19. We're seeing a very large number of cases and deaths in these communities, and so there is a lot of work to be done. And so what we hope is that these inequities that have been exposed, we hope to address them in real time, but also in the long term as well. Dr. Vasan, you have been doing similar equity work over the last few years, and I know that you've seen inequities in our system. Can you tell me about your experience, especially with the pandemic thus far?
Yeah, thanks, Uche. My name is Dr. Ashwin Vasan. I'm the president and CEO of Fountain House, a nonprofit organization, a national nonprofit organization that is supporting people living with mental health issues with health, social services, and other therapeutic community supports. And I'm also a practicing primary care physician and a public health professor here in New York. And what I'm seeing on both fronts, whether it's in my clinical role or in my role at Fountain House, is the impact of this pandemic falling disproportionately on already vulnerable communities. And that includes not only racial and socioeconomic disparities that you so rightly highlighted, but also disparities based on other forms of marginalization, whether it's people who are chronically homeless, people who are incarcerated or formerly incarcerated, and people living with pre-existing mental illness. And the other thing I'm seeing is really a coming wave, a second pandemic, as some are calling it, of mental health concerns. And I think that's simply a function of just the conditions we're living in and the stress we're living in. Now, if you're already vulnerable, that's just a recipe for more challenges. So I think we're seeing that coming, and we're going to have to address it going forward.
And as you know, we really need to, both in the short and long term, think about these social determinants of health, like quality education, adequate housing, and gainful employment, to ensure that these communities are no longer vulnerable.
I think our collective challenge here is to really recognize that we're all in this together. What I'm feeling, what you're feeling, which is isolation, which is the inability to be close to our friends, to our colleagues, to people we love and care about, the effects that that's having on our own well-being, our health, our sense of self, our sense of purpose. Now imagine that same set of feelings is being felt by people who are already pushed to the margins, already socially isolated, already at risk of quote unquote falling through the cracks of some of our systems. I hope that this is a moment where we can really come together and see ourselves as truly connected, where we can spare a moment for someone who's going through the same exact thing as you, just in a more extreme form. This is one of the few events in living memory where we're all experiencing some approximation of the same conditions. And then, of course, it's falling disproportionately, and it's disproportionately more extreme on people who are already vulnerable. So this is an opportunity, I think, for us to connect across those divisions, across income, class, race, socioeconomic status, where you live, what your neighborhood is, what you have access to, all the social determinants of health that you just mentioned. Now is a time for us to spare a moment to think about those on the other end of that spectrum,